Well, hi, Bob. I'm good, thanks. Thanks for having me today.
Yeah, how was your day in the office? Okay, routine.
Yeah, it
And
was fine. Fairly busy day, but that's typical. That's the usual of how they go around here.
would you mind sharing with the audience? I know you're a private practice. Would you mind sharing your specialty, how many years you've been practicing, and where you did your training?
Yeah, sure, Bob. I'm in Reynoldsburg, Ohio. I'm a family physician and general internal medicine physician, and I have been practicing since, well, 21 years now, 22 years of general internal medicine, and went to school. I'm Canadian originally, so I went to school at a place called University of Western Ontario, and then did my training and my residency at the University of Toronto in downtown Toronto, and now I'm in Columbus, Ohio, a suburb of Columbus, Ohio.
Awesome, awesome. Well, for the audience, my name's Bob Wagner, and my wife and I have been involved with introducing wellness programs to doctors for over 20 years. And we had the good fortune of meeting you about 10 years ago. And you had never dealt with really weight management, supplementation, wellness, nutritional product. You'd never handled anything like that before that, had you?
No, I had not done any of that until I met you. Yeah, about 10 years ago.
Well, what's really interesting and what we want the audience to understand is for over 10 years, and I don't know if you know this number, but you had ordered over $1 million worth of these supplements wholesale,
Hmm.
and been taking really good care of your patients. But in the last 6, 7 months, we were introduced to some new science and some new ways of doing things, and it seems like supplementation is kind of the old way of doing things. The old traditional omega and CoQ10 and fat burners and just vitamin C or vitamin D. It just there seems to be something new going on, meaning more along the lines of we're now activating a person's body to do the things that it did when we were a kid, 18, 19, 20 years old, and getting our bodies to just do what God intended for them to do. And would you mind sharing, what your experience has been, with this NRF2 and NRF1 Protandim activation stuff? Would everybody, that's going to hear this, they're probably going to be hearing it for the first time. So would you share in layman's terms what's going on with your patients for the last 6, 7 months?
Yeah, sure, Bob. I think you're exactly right in how you described it. Previously, we had told patients to take these antioxidants or to eat antioxidants, things like, blueberries and green leafy vegetables and spinach, and to take things like, vitamin E and vitamin C, which are what I call exogenous or sort of the outside antioxidants. But what the Protandim and the NRF2 really does, and the science behind it, they promote the body to produce their own antioxidants. So the antioxidants that we used to give from the outside would last, I don't know, maybe half an hour, 45 minutes. Who knows how long they lasted in the body? Whereas the Protandim, the NRF2, what that does, it has the body stimulates its own production of antioxidants, so it's constantly mopping up antioxidants in the system. And I sort of look at it, these byproducts of oxidation, meaning the cell has to breathe, the cell uses oxygen. The byproducts of that are these free radicals, and these are the things that cause damage to to the tissues, to the cells, to the tissues, and then to the organs of the body. So I think it's a great product in the fact that we're not just giving an antioxidant from the outside. It's used up in 45 minutes. The body continues to produce it because of the NRF2 activation, that the person or the patient, their own body is producing these enzymes to mop up the antioxidants and or to mop up the byproducts of oxidation. So this oxidative stress, as it's called, I think this is probably, this is what causes most disease in the human body. There's lots and lots and lots of research on it. But I think especially the neurodegenerative diseases, so things like Alzheimer's and Parkinson's These, I think, are caused by the byproducts of oxidation in the cell. And so where I've seen a lot of benefit in my patients over the past 6 months, we have a lot of elderly patients. We have a lot of patients with dementia. We have Parkinson's. And that's where I'm really fitting it in to see it's not reversing things, but we do see better cognitive abilities on these patients because I think there's less damage to the brain tissue. And that's where I really like the use of it. Things like these treatments now for things like multiple sclerosis, these are actually some of the new treatments are sort of offshoots of these herbals that we've been using in the NRF2 and the Protandim. So it all goes together. There's published reports on it, and I just think it's a really safe and effective way to add on to. You always have to use medical treatment, but these are add-ons, and it's showing pretty significant benefit in some of my patients.
Now, Dr. Wolf, and correct me if I say this wrong, because I'm a business person. I'm not a medical professional, but I've looked at PubMed.gov and there's, I don't know, 24, 25 peer-reviewed studies on Protandim, and there's a lot of talk about Protandim reducing oxidative stress by up to 40% guaranteed in the first 30 days. Up to 70% after a few months. And if oxidative stress is a lead into disease, okay, if it's something that leads to disease, is there any reason why somebody, 30 years old, 20, 30, 40, 50, 60, 70, if they want to take preventative measures, is there any reason for anyone not to use it?
No, there's no reason at all that I can see. And I've looked at those studies and I've used it on patients. There's no reason not to use it, not at all.
I know there's a big university right near you called, I think they call it Ohio State University. I'm
That's
not
what they
sure.
call it. That's Ohio State.
School there.
Yeah, they have a pretty good football team most of the years.
Most years, and every other sport too. But
right.
I believe they did a study on the Protandim. Is that correct?
Yeah, that's correct. Ohio State was one of the research centers. University of Colorado was another one, but yeah, these are major research centers that are doing the studies. So they're not just small privately funded research studies. They're from major universities.
Well, I guess the results you're seeing, because for the folks listening, I happen to see your orders, when you're ordering more Protandim, when you're ordering more of our fat burner and stuff. And every month, things just seem to be doubling from the month before. So it just seems like you're not getting a lot of resistance on it, and your patients using it or staying on it. Is that accurate?
Yeah, that's very accurate. And what I really like about these products is, when I talk to a patient about it and I recommend the product and they start it, what happens is they just come back to my office and they get more. So that's sort of a testimony to the product itself, that I don't have to say anything more. They use it once and they're back in and they're back in and they're back in reordering. And so that to me shows the effectiveness and the quality of these products, is that the patient themselves just marches right in and that's the way it goes now. Once they start, they want to continue to take it.
Now you own your own practice and you have a staff that can handle that transaction and monitor having some inventory there. For the doctors that may be working with a big group or be employed, that monthly subscription program where a patient can just be ordering direct, on a monthly subscription, I mean, that would work very well also, right? They don't have to be able to run transactions to be able to share the benefits of this with their patients, do they?
No, definitely not. They can direct the patient to the website, and the patient can order it directly from there. So you don't have the physical product in the office. I just happen to do it that way because it's worked for me quite well.
And you can,
Yeah,
you're your own boss and no partners. No, you can do whatever you want. So
Right.
Let me ask you something else.
Sure.
I've noticed that, we have a fat burner as a product, but it works very differently than a lot of these other weight loss products where, they can kind of burn out your adrenal gland and after a while they stop working. And the same thing seems to be going on with our fat burner as with the Protandim. It just seems to be doubling up every
Hmm.
month. And what's going on with that? It's getting
Well,
pretty big. Your orders are getting very large.
yeah, I mean, that's the same thing. Again, we have here in Central Ohio, there's a lot of obesity, there's a lot of diabetes, there's a lot of heart disease. And the number one thing that I tell people most of the time is you got to lose weight, you got to lose weight. And so I use that. And the Physique Fat Burner is a really effective product with no side effects. I have yet to have a patient say to me, that they've had heart palpitations or they feel stimulated or they feel like they've had one or two extra cups of coffee. These are what the old time ones, these fat burner stimulants do. And that goes against everything that, I'm trying to accomplish, meaning I make them feel badly. They have symptoms of a supplement. And so that is not useful. And what I find with the Physique, the fat burn, it works, it's safe. They have no side effects. They do not get the stimulant effects that the old-fashioned ones do. And I should also tell you, Bob, being here in Columbus and with Ohio State close by, I've run the ingredients by some of the pharmacologists at Ohio State who worked on this, and with our patient population, they are really encouraging us, to use these products and to and really verify the safety of these products, especially with drug-drug interactions that we're also worried about in patients. And I've run this by a couple of pharmacologists, and they think these products are very safe and that they're effective. So again, the same thing with the Physique Fat Burn. Patients start it, I get them on it, but they just keep coming back to my office and getting more from from my staff at the front desk. So they just reorder it themselves. They march in here and they say, I want my Physique Fat Burner again for this month. So that's why the sales have gone up and the volume has gone up. Patients themselves just keep ordering it.
Well, I tell you, it's got to be very comforting knowing for the first time, as a doctor with getting in the arena of wellness and prevention and, anti-aging, really, getting into something that truly, I mean, Protandim has been scientifically proven that it can add years to your life. I mean, that's in, the NIH did a study on that. But one of the things that's got to bring some comfort to you is 14 patents on these products and like I said, 24, 25 peer-reviewed studies. That's got to bring you some comfort as a doctor, no?
Oh, for sure, because the first rule of medicine is do no harm to the patient. So the fact that these are peer-reviewed studies, there's patents, that is a huge thing in my practice. That I'm giving a product that is safe, it's effective, and it will do no harm to our patients. So that is our primary concern first off. And then secondary, of course, is the effectiveness of it, which, as you can see from my product sales, it's effective. People just come back for more.
Well, if you don't mind, I know you keep records and documents. So, we're talking here on the beginning of June for like a 6-month update. Maybe we can revisit again at the end of the year and get like a 12-month update on what's going on at that time. Would you be okay with that?
Yeah, that sounds great, Bob. I'd love to.
Well, I appreciate you taking time out to talk to us today. And, it's very helpful. I'm sure a lot of other doctors appreciate hearing what you have to say. And you have a great day. And thanks a lot.
Yeah, thank you, Bob. Thanks for having me. Have a great day, too.